Sharma sir, Professor Emeritus, STM 3 to take over the session. Welcome to you, sir.
Okay. अथा तो रक्तपित्तप्रतिषेधं व्याख्यास्यामः यथोवाच भगवन्तः. The next is about the Raktapitta. क्रोध शोक भय आयास विरुद्ध अन्न आतप अनलान्न कटु अम्ल लवण क्षार तीक्ष्ण उष्ण अतिविदाहिनः नित्यम् अभ्यसतो दुष्टो रसः पित्तं प्रकोपयेत् विदग्धं सगुणैः पित्तं विदहति आशिशोणितं ततः प्रवर्तय रक्तम् ऊर्ध्वं चादोद्युदापि वा. Now, the etiological factors for the Raktapitta are the either emotional disturbances like anger or maybe sorrow or fear, or tiredness or food, the diet also, or exposure to very high sunlight continuously, or consumption of the food which is sour or katu, pungent or lavana, kshara. These taste continuously, it can result in the initiation of the pitta, and that pitta affects the rasa, and it results in the abnormality of the rakta, which is, and there is a tendency for bleeding, which could be either from the superior side or in the sense from the oral and nasal routes, or maybe from the anal or rectal route or vaginal route, or it could be somewhere throughout the body, the collagen tissue, there, all throughout the body there could be rupture, and the bleeding could occur. Amashayat व्रजेत ऊर्ध्वम् अधः पक्वाशयात् व्रजेत विदग्धयोः द्वयोश्चापि द्विधा भागं प्रवर्तते. केचित् सयकृतप्लीष्णः प्रवदन्ति अस्वजोगतिम्. The source of bleeding, when it is from the upper part of the body, that means oral or maybe the nasal, the pathology is more concentrated in the amashaya, whereas when the pathology is more concentrated in pakvashaya, it will be in the downwards like anus or the rectum or the vagina, or maybe the urethra. Then when there is a involvement of both, then it could be throughout the body. The generalized bleeding tendency can occur. Urdhvam, and according to some, even the role of yakrita and pliha, maybe the liver and the spleen also could be the cause for this bleeding disorder. अतः ऊर्ध्वं साध्यम् अधो याप्यम् असाध्यं युगपद्गतम्. ऊर्ध्वगत व्याधि, that's the diseases where there is a bleeding from the oral or nasal route, is considered sadhya, whereas through the anal or vaginal route downwards is considered as yapya, whereas throughout systemic involvement would be considered as asadhya. Now, as far as the bleeding tendency and the phenomena of the prevention of the bleeding in the body is mainly by the mechanism of what we call as homeostasis. Hemostasis is the phenomena where the body would prevent the blood from getting leaked out throughout the circulation, and mainly the technique, the causes could, or rather what happens is the mechanism would be, once there is an injury to the blood vessel, then there would be a local response. So first of the response will be the vascular spasm. The blood vessel will go into spasm, and as the opening narrows, naturally the amount of the blood which can flow out would be lesser. The next part is the platelets, they tend to get aggregated, and the platelets plug in the area. The platelets, they float to the area and they produce a temporary plug so that the bleeding would not occur. Then there is a next process of advanced process of coagulation, where a soluble prothrombin is converted into a fibrin which is insoluble, and hence the whole opening is a closed. This is what we call as a clot. A clot would occur. So the phenomena of clotting is the hemostatic mechanism, and this phenomena of clotting, that's a conversion of the prothrombin which is soluble in water would be converted into an insoluble fibrin, is having a cascading effect. Like, see, there is a step-by-step effect, and it could be initiated by two mechanisms, extrinsic mechanism or intrinsic mechanism. Extrinsic mechanism is where the vessels are damaged, and that results in the aggregation of the platelets would contain prothrombin breaks down, and then the different factors of the clotting, which we consider as clotting factors, about 13 of them are identified, and they will produce the conversion of the prothrombin into thrombin. Calcium is one of the most important ingredient, or rather factor, which kickstarts this process of prothrombin to break down into the clot as such. Clot, after all, is a network of fibrin material. Intrinsic mechanism is when there is a trauma outside the body, but vessels may not be injured, it starts with the chemical substances released, and that results in the same phenomenon. Further, after one stage, the phenomenon is the same, the clotting would occur. So the coagulation factors are the important issue. But once the clotting occurs, now in the routine conditions, the clot doesn't occur in the body. Normally the blood remains in this liquid state. Clot is prevented from occurring in the body unless there is a need for that, like an injury, either extravascular or intravascular injury, the clot should not occur, and this would be prevented by mainly the three mechanisms. The one is there is a coagulation inhibitors, the chemicals which are present in the body, which can prevent or reduce the possibility of coagulation, and whenever there is a stimulation for the coagulation factors come into the picture. Otherwise, these clotting factors, they would be kept in an inactive state. Like the thrombin is always presented in the body in the form of a prothrombin, which cannot be activated. Only when there is a real stimulation, prothrombin gets activated into thrombin, and then the process starts. So that's how the one mechanism. The other mechanism by which the clot would not occur would be the smooth condition of the tunica intima of the vessels, blood vessels, both artery and the veins. The mucosal surface in the inner surface would be having a extremely smooth character, which are non-sticking. The blood cells would not stick, because the clot would start only when the platelets get aggregated or the platelets get ruptured. So prothrombin release is the first step. Now, if the vessels are extremely smooth, then the chances of the platelet getting stuck to that area and resulting in the breakdown would be lesser. So normal mucosa or tunica intima of the vessels, both artery and the veins, they are extremely smooth and non-sticking, so that the cells do not stick, and hence in a normal situation the blood would not clot. Another phenomena which prevents the clotting is the laminar flow of the blood. The blood flows in the vessels smoothly in such a way that all the cellular elements would be in the central zone, or which we also axial zone, whereas the fluid component will be outside. Hence the cells sticking into the vessel wall would be lesser, and hence that as long as flow is laminar or there is no turbid flow, the chances of clotting would not occur. If the flow is obstructed, like, or there is a maybe turbidity in the flow, as in case of valvular defects of the heart, or a vessel is compressed, the blood flow may become turbid, it may not remain smooth laminar, and in such conditions there is a risk of clotting. So that's how it can result in what we call as the thrombosis conditions or thromboembolism conditions. Embolus is a clot which occurs in the body, within the body is embolus, and it can occur due to a turbid flow which could be produced due to that. Then the third factor is maintenance of the viscosity. The ratio between the cellular element and the fluid element would be maintained in such a way that the unexpected clotting would not occur. If the viscosity is altered, if the viscosity raises, the hematocrit value raises, then the cells may become precipitated, cells may become coagulated, and then the whole process of clotting can start. So the three factors which prevent the clotting within the body, the embolization would be prevented by, are one, the laminar flow, then the vascular smoothness, the smoothness condition of the vessel wall, or the third is the viscosity. If any of these three altered, then there could be a clot factor. In the normal day-to-day life, there could be many situations when any of these factors may be temporarily altered, and some clots may occur. Now, such a clot would be dissolved by fibrinolytic substances in the body. So fibrinolysis is also a normal course. So if some minor clot is formed due to day-to-day activity, that would be managed by the fibrinolytic agents in the body. So the whole phenomena of clotting is a very complex phenomena, and this has both the components of a stimulation of the clotting as well as a prevention of unexpected or unwanted clotting, and as well as dissolution of any unexpected clot which has occurred, so that the body is protected. Now all these three phenomena are kept in a balanced situation, and as long as these are kept in a balanced situation, then there would not be any unexpected bleeding or unexpected clotting. Now, when there is a abnormality of these, which could be produced due to the same causes which are mentioned as a causes of the Raktapitta, like exposure to the heat, even psychological stress, where the vessel wall could be, the pressure of the circulation may become altered, or the vessel wall condition could be altered, it can result in either a failure of the clotting or a increased chances of the clotting, embolism or embolus formation, or there could be bleeding tendencies. Now, to assess these bleeding tendencies, now Raktapitta of course is related to mainly the bleeding tendencies, whereas the Vata Rakta mentioned by our Ayurvedic text relates to the situation where there would be abnormal clotting, where the Rakta Patha would be obstructed. Now, these two phenomena of a uncontrolled clotting phenomena, failure of the hemostasis resulting in the bleeding, is due to involvement of the Pitta with the Rakta, and hence there would be Rakta Pitta pathology. Whereas the other possibility of a clotting which occurs in the body due to the blockade is due to the involvement of Vata, and the Vata Rakta is there. So the understanding of the phenomena of the clotting can be interpreted in terms of these Pitta dosha and the Vata dosha, in terms of these phenomena of prevention and the maintenance of the hemostasis. Now, from the clinical point of view, when a patient presents with the bleeding tendencies, the important investigations which are done to assess the real cause. Now, of course, exact causes. We follow the methods of investigations of either the common bleeding time, clotting time, or prothrombin time, or maybe activated clotting time. Now, bleeding time, the method is simple, where you may be putting a small incision or puncture a tip of the finger or the earlobe where the capillaries are present as such easily, and allow the bleeding to occur, and go on just removing the blood, wait till the bleeding stops spontaneously. On an average, it's around 2 to 7 minutes. Within that, is considered as normal. A increase it could occur where the time may be more than 9 to 15 minutes. A platelet dysfunction is expected. If the bleeding continues for more than 15 minutes, it is critical, and your test must be discontinued. Pressure should be applied and take care of that bleeding spot. The causes of abnormal high bleeding time or prolonged bleeding time could be due to any collagen tissue disorder. Now, the bleeding time mainly assesses the capacity of the vessels to constrict, the collagen tissue capacity to make the vessels constrict, and the platelets to move into the area, and the platelet plugging phenomena are assessed by the bleeding time. And the diseases like collagen tissue disorders like Van Willebrand disease, or the thrombocythemia where the platelet count could be lesser, or the Bernard-Soulier syndrome where there are again the glucose 6-phosphate deficiency is are connective tissue disorders like Ehlers-Danlos syndrome, so on, groups of syndrome, hereditary hemorrhagic telangiectasia, where collagen tissue is abnormal. These can result in very prolonged duration of bleeding time. A shorter bleeding time would be either it could be technical error, like when you have not punctured properly, or any conditions where there could be increased viscosity, like a blood loss, burns, and so on, or patients who is dehydrated, or patients with polycythemia. In these conditions, the bleeding time could be lesser than normal. In newborn, it's quite common that the bleeding time could be less than 1 minute in the initial stages due to the presence of the many of those hormonal substances present in the blood. Abnormal bleeding time also could occur due to the acquired causes. Now, whatever we have discussed is a congenital cause. It also can occur due to many medications like as salicylic acid, which prevents the platelet aggregation. Platelet aggregation inhibitor drugs, groups of drugs, or anti-inflammatory drugs. Certain of the antibiotics like penicillin, cephalosporins, anticoagulants specifically given for the purpose of prevention of the clotting, or tricyclic antidepressants, psychotic drugs also can enhance the bleeding time. The tendency for bleeding can occur. Or tendency for the bleeding also could be more in vitamin C deficiency, alcohol intoxication, uremia, liver failure, leukemias, or any of those conditions where the bone marrow is not functioning properly, or diseases like amyloidosis where there is a deposition disorder. It can result in increased bleeding time. Then the other is the clotting time. The clotting time, the most common method which is assessed is a capillary tube method, where the blood is sucked into a capillary, and then you go on breaking the capillary at small pieces. So the time when the clot is formed, you will see a fibrous substance in between that broken capillary, and that time is noted. But this test is not very sensitive. Chances of error or misconception interpretation are more, but still is one of the standard method which can somewhat predict the possibility of abnormal clotting in the body. Though the main purpose of this clotting is to assess the functionality of the clotting factors. The normal range is around 80 to 15 minutes. A normal clotting time doesn't rule out a coagulative pathology. Really abnormal, if it is persisting more than 15 minutes, then naturally it's very obvious that there is an abnormality of the clotting phenomena and mainly the clotting factor. So to have more accurate assessment, the other method is prothrombin time. In the prothrombin time, the blood is connected with an anticoagulant drug like sodium citrate, so that the clotting factors otherwise are, or the whole clotting cascade effect is prevented. Then into that blood you add calcium and thromboplastin, the clotting factor, the triggers of the clotting factor, and assess the time taken for the clotting to occur in the body, the fibrin formation in the blood, in the test tube, so that it will be accurate. So this prothrombin time is more accurate about the prediction of the clotting phenomena in the body, and the normal range is around 11 to 12.5 seconds. And to avoid certain errors of the chemicals, now there is a international normalized ratio. The result is given in the form of, not in the form of time, but the result is given in the form of INR, that's international normalized ratio. These are due to certain possibility of errors due to the variation in the chemicals and individual variations. So there is a statistical analysis representation of this issue in the form of INR, and the normal range of INR is considered as 0.8 to 1.1. If it is more than 1.1, that means there is a abnormal clotting phenomena which could be due to any of the factors being affected. Now, the prolonged prothrombin time could be seen in patients who are on oral anticoagulant drugs like warfarin, or vitamin K deficiencies, or patients who have obstructive jaundice, malabsorption pathology, or patients who use certain drugs which can reduce the possibility of clotting, or patients due to liver disorder where there is a abnormality of synthesis of vitamin K or the clotting factors. Majority of the clotting factors are synthesized in the liver, so the abnormalities thereon can be a cause for this. And deficiency of present inhibitors to factors, the clotting factor inhibitors present in excess, also like factor 7, factor 10, or factor 2 prothrombin inhibitors, fibrinogen inhibitors, if they are present in abnormality, then abnormal concentration, the prothrombin time could be enhanced. Diseases like DIC, disseminated intravascular coagulopathy, or abnormality of fibrinogen synthesis, genetic abnormality, where either there is a fibrinogen is less than normal, hypofibrinogenemia, or afibrinogenemia, or dysfibrinogenemia, where the type of the fibrinogen is abnormal, or after the administration of heparin temporarily, immediately after the administration of this heparin, if you assess the prothrombin time, it will be enhanced. After a massive blood transfusion, the prothrombin time tends to be increased. If the patient has hypothermia, then too it could be increased. Prothrombin time could be reduced if the patient is given vitamin K, or in the patient, if the patient is given a frozen plasma transfusion, then too it could be reduced. So clinically it's one of the useful tool to make out the abnormalities of this. Now, prothrombin time gives an idea like there is an abnormality of the clotting, but which of the real clotting factor is abnormal cannot be made out with the prothrombin time. To have that idea, activated clotting time or ACT is done, but ACT is usually done, need of that will be done mainly in the ICU setup. Routinely, in the routine clinical practice, it may not be. And the ACT, the mechanism would be almost similar like that of the prothrombin time, but instead of adding thromboplastin and calcium in this anticoagulated blood, specific these factors are added, so that you'll see like which of the factor can stimulate the clotting in that blood, and hence the specific abnormality of that factor, like either factor 12 or factor 7 or factor 10, each of these factors can be specifically studied, and that can make out like which of the factor is then that's activated clotting time is the target. It's not routinely done in the clinical practice. Most of the times this is done in the ICU setup, or the need of that would be needed like when a patient is on dialysis, cardiac catheterization, usually intraoperative during the invasive procedures, during the procedure, to monitor the status of the patient, where there is a need of directly handling the blood vessels directly. This investigation may be required, like the aortic balloon pumping, cardiac percutaneous interventions, or extracorporeal membrane oxygenation, vascular surgeries, valve replacements, carotid endarterectomy, so on. In these conditions, they are done. So that's about the investigations to identify the pathology related to the bleeding. Now, of course, all these details can still be understood in the framework of Raktapitta. Maybe these individual variations may give more specific information, and of course the approach to the treatment also can become more specific and target oriented. Anyway, that's about the comparison or maybe understanding of the Raktapitta from the contemporary situation with somewhat extra details. Now, clinical symptoms of Raktapitta: sadanam shitakamitvam kanthadhumayanam momihi lohagandishta nishwaso bhavat yasmin bhavishyati. The Pururupa, the prodromal symptoms of Raktapitta is the patient may have a reduced capacity to action, like reduced activity. Sadanam is reduced activity. Shitakamitvam, tendency to or opting for the cold. Kanthadhumayanam, burning sensation in the neck, or omitting lohagandishta nishwasa, a metallic smell in the breath. A metallic smell in the breath is quite common when there is a bleeding into the respiratory tract or gastrointestinal tract. Bahyasrud lakshane tasya sankhya-doshachyahi vidhu. Based upon the location of the bleeding and the other clinical signs, there could be multiple variants of Raktapitta. Like a patient having the bleeding from the vagina, it could be considered as Pradhara. If there is a bleeding from the bladder, it could be considered as a Mutra abnormality like Mutra Kricha or Mutra Ghata, so on and so forth. And hence, each of these have to be maybe named with the different names, or the total number of variants can be more. दौर्बल्य श्वास कास ज्वर वमथु मदाह तंद्रिता दाहमूर्छाः भुक्ते च अन्ये विदाः तो अधृतिरपि सदा हृदयतुल्या च पीडा तृष्णा कंठस्य भेदः शिरस्य च दबनं पूतिनिश्चीवनं च देशो भक्तो अविपाके विरतिरपि रते रक्तपित्तोपसर्गाः. The Raktapitta Vyadhi, patients who have that bleeding tendency, they would have the other symptoms, and all the other symptoms of blood loss, where there is either acute blood loss or chronic blood loss. Acute blood loss can result in Daurbalya, weakness, Shwasa, Kasa, breathlessness, or the Madaha, Tandritaha, Dahamurcha, altered consciousness, and these are the signs of acute blood loss. In chronic blood loss, which results in a reduced immunity or anemia, it could be Jwaravathu Nadaha, Jwaravathu, or Anne Vidaha, abnormal digestion, Adhrutirapi, a unstability of the body. Hrityatulyati pida, there could be a pain in the chest also. And kantasya vedaha shirasi davanam putinishchivananja, dvesho bhakte, these could be the other features of the chronic blood loss. The complications or symptoms which could be accompanying the signs of Raktapitta are categorized into two. Now, based upon the appearance of the blood which is lost or which is leaked out, the dosha assessment could be made out by looking at the color. This is Ayurvedic perception. Mamsa prakshalanabham kvatitam ivacha is the kardamamho nivam va meda puyasa kalpam yakriva yadiva pakojambu parabham yas krishnam yacha neelam vrisham atikunapam yatra choktaha vikaraha tadvatyam raktapitam surapati dhanusha yacha tulyam bhavati. If the blood lost is or the bleeding blood would be having altered color and altered appearance, gravity, mamsa prakshalanabham, as if it is washed out of the flesh, or as if it is seen to be boiled blood, or which looks like the mud, kardamamba, the mud water, muddy water like, or which it has a pus like or medas, fatty substances, or which has a color of the liver, somewhat greyish like, or pakko jambu, that is somewhat blackish color as such, or dark black as krishnam, or neelam, bluish color, or which is extremely foul smelling. These are the conditions where the treatment would not be possible, condition would be having poor prognosis. This is due to the abnormalities of the serious abnormality of the chemical constitution of the blood, that there could be these changes in the color. Nadav chandrahyam udriktam yad asrak balinam ashnatah tat pandu grahani kushta priha gudmadvaraham. If a patient has a bleeding from any of the natural cavities of the body, and if the patient is otherwise stable, condition is stable, should not suppress the bleeding, should not stop the bleeding immediately. Allow that deformed blood to flow out, otherwise it can result in the complications like Pandu, Grahani, Kushta, etc. The other complications can occur. So, if a vitiated blood is leaking out spontaneously, that should not be stopped. There is another of the phenomena. From the contemporary science point of view, you do not have that kind of a situation where a vitiated blood is allowed to go there. So, it's not a accepted phenomena in the contemporary medical practice, like to allow the blood to flow out. If there is a bleeding, the first attempt would be to arrest the bleeding, would be the trend now in the contemporary situation. Issue of controversy will not go beyond that. अथप्रवृत्तं मनेः ऊर्ध्वगं च विरेचनैः जयेद् अन्यतरद्वापि क्षीणस्य शमनैः असृत्. The general line of the treatment is if there is a bleeding from the lower part like anus or the vagina etc., vamana is the main line of the treatment. So it's just the opposite direction of the movement of the blood. Urdhvaga, if it is through the oral or nasal route, then virechana is the main line of the treatment. If there is a systemic involvement, then it could be both vamana or the virechana as well as shamana aushadis could be given. Atipravritta doshasya purvam lohitapittinah akshina balamahamsagnehe kartavyam apatarpanam. The first step of the treatment is apatarpana. Apatarpana is giving laghu ahara and not much of a heavy nourishment food like. लंघितस्य सुरपेयं विदध्यात स्वल्पतण्डुलां रसे दिशो प्रदातव्य सुरभिः स्नेहसंस्कृतौ तर्पणं पाचनं लेहान् सर्पिंश विधानि च. So after the apatarpana, once the patient's digestive capacity has increased, gradually you have to give him light food like peya with the salpatandula, that's with the minimal rice, more liquid ganji is given, or other rasa liquid substances are given with the maybe ghee or so on, and pachana leha also could be given, ghrita yogas could be given. Draksha, madhuka, kashmariya, sita, yuktam virechanam, yasti madhuka yuktam sakshadra manmihitam. If you have to give virechana, the virechana should be done with the madhura aushadis, brahmana aushadis like draksha, madhuka, etc. If it is vamana, yasti madhu or kshaudra, honey is used for the vamana. पयांसी शीतानि रसाश्च जांगलाः सतीन युषाश्च शालिषष्टिकाः पटोल शीलु सुनिषण्ण यूचिका वटा अतिमुक्ता अंकुर सिंधुवारम वटांकुर मुक्ता and अंकुर सिंधुवारम स्तंजशाकं घृतसंस्कृतं तदा तथैव धात्री फलदाडिमान्वितं रसाश्च पारावत शङ्खकूर्मजाताः कूर्मजाः तथा यवागो भीताः घृतोत्तराः सन्तानिकाश्च उत्पलवर्गसाधिते क्षीरे प्रशस्ताः मधुशर्करोत्तराः हिमाः प्रदेः मधुरागणाश्च ये घृतानि प्रत्यानि रक्तपित्तिनां for the Raktapitta all Shitavirya Dravyas of different categories which could be either vegetarian or non-vegetarian origin which are easily digestible, they are given, and the list of that is like Shasya Shali, Patola Shilu, etc. One, or it could be the flesh of birds like Paravata, Shank, Kurma, etc. The birds and animals, or Santanika is the cream of the milk with the Uttala Varga, Uttala as it, Madhushankara, such of the drugs are given, and cold application over the body also are suggested. मधुक शोभांजन कोविदारजैः प्रियंकायाः कुसुमेश्च चूर्णितैः भिषग्विदद्यात् चतुरसमाक्षिकान् हिताय लेहान् असज प्रशान्तये लिष्याच्च दूर्वा वटजांश्च पल्लवान् मधुद्वितीयान् सितकर्णिकस्य हितं खर्जूरफलं समाक्षिकं फलानि च अन्यान्यपि सद्गुणान्यथा. The other way, other of the suggested food supplements could be like shobhanjana, that's your bamboo, this drumstick flowers, again prepared in the form of vileha with all the makshika and other drugs, or durva, or even vatapalla, that's your ficus, tender leaves of the ficus, or kharjura phala. Kharjura is also suggested as one of the drugs, or any of the other substances which have the similar quality of madhura rasa and shitavirya, they could be given. Raktatisara proktam shevagan atrapi adeta. All the treatment protocol of the Raktatisara also can be used in this. Shuddha Ikshukandam apokya nave kumbe himambasa yojayitva kshiped ratro avakashe sautpalam tad pratasudam shaudrayitam vived shonita pittavana. Ikshurasa, the sugarcane juice which is kept overnight in cold water, a vessel kept in a cold water, with the kshaudra, honey is given as one of the remedy for Raktapitta. पिबेत् शीतकषायं च जम्बु आम्र अर्जुन संभवं उदुम्बरफलं पिष्ट्वा पिबेत् तद्रसमेव च. जम्बु आम्र अर्जुन कषाय also could be given. तपुषि मूलकल्कं वा सक्षौद्रं तण्डुलाम्बना पिबेत् अक्षसमं कल्कं यष्टि मधुकमेव च. चन्दनं मधुकं रौद्रम् एवमेव समं पिबेत्. करञ्जबीजम् एवं च सिताक्षौद्रयुतं पिबेत्. मध्याह्नं इङ्गुदये एवं पिबेत् मधुकसंयुतं सुखोष्णं लवणं बीजं कारञ्जं दधिमस्तुना पिबेत्वापि त्रेहं मर्त्यो रक्तपित्ताभिपीडितः रक्तपित्तहरा शस्ताः षडैते योगसत्तमाः. Each of the shloka, half of the shloka is one of the yoga, and any of these yoga could be given for Raktapitta. Patyashchaiva avapideshu granatha prasade asaje. Avapidanasya could be given in case of nasal bleeding or epistaxis. Ati nishrut rakto va kshatru yuktam pibedasrat ekratva bhakshed ajam amam pitta samayitam. If there is excessive bleeding, Sushra suggests about a drinking of the blood with the kshaudra, with the honey. Or it could be a raw liver of goats could be given along with the pitta, along with that biliary secretions given as it could be a raw liver of the goat can be eaten. Palasha vrikshaswarase vipakkum sarpipivet kshaudritam sushitam वनस्पतीनां स्वरसैः कृतं वा सशर्करं क्षीरघृतं पिबेत् वा द्राक्षां उशीराणि अथ पद्मकं च सिता पृथक् फलांशानि उदके समावपेत् स्थितं नशां तद्रुधिरामयं तेत् पीतं पयो वा अम्बुसं हिताशिनः तुरङ्गवर्चस्वरसं समाक्षिकं पिबेत् सिता क्षौद्रयुतं वृषस्य वा गृहेत् तदा वास्तुकबीजचूर्णं क्षौद्रान्वितं तण्डसाह्वयं वा लिष्याच्च लाजा अञ्जनचूर्णम् एकम् एवं सिताक्षौद्रयुतां दगाख्यं द्राक्षां सितां पिक्तकरोहिणीं च हिमाम्बुना वा मधुकेन युक्तां प्रख्यां महिंसां रजनीं रसं लिष्यात् तथा शोणितपित्तरोगी. The other yogas which could be suggested, again some of them are very complicated, like with odd, like the feces of the horse, juices extracted from the feces of the horse dung. With the makshika is one of the such, or it may be the bullocks also, the dung of bullocks also can be given, which are seem to be odd, so not much of the issue to comment on that. But the other drugs which you have the Kashaya Rasa, Tikta Rasa and Madhura Vipaka, they are suggested as the other options. Or similarly, other drugs are Vasa Kashaya, Uttala Mrit Priyangu, Rodhanjana Amburuha Kesharani, Pitwa Asita Kshaudritan Jashyat, Pitasuro Vegam Udinamasho, in the acute bleeding conditions of Raktapitta, Vasa Kashaya, Binta Utpala, etc. had to be given. Gayatri, Jambu, Arjuna, Kovidara, Shirisha, Rodha, Ashana, Shalmalina, Pushpadi, Shigroscha, Vijur Nileho, Madhvanvitaha, Shonitaroge. Shigur Pushpa is one of the frequently recommended drug in case of bleeding conditions, and it could be along with the Madhu and other drugs. Sakshodram, Indivara, Bhasmabari, Karanja Bijam, Madhusarpishicha, Jambu, Arjunam, Amra Kwachitam Chatoyam, Bhantitraya, Pittam, Asrakcha Yoga. These yogas are for Indivara, that's the lotus Bhasma and Karanja Bija, etc. Then Mulani Pushpani Matulungyaha Pishtva Pibet Tadula Dhavanena Grana Purute Jalamashudeyam Sashakaram Nasikaya Payova Matulunga Pushpa or Matulunga root can be given with the Tandula Dhavan, the rice water as such, which could be given either oral route or through the nasal route. Draksharasam Kshiradasam Vivekva Sashakaram Chaikshirasam Hemva. Daksharasa, Kshiradata, also again, all Brahman Aushadhis are suggested. Hizopacharam, Madhuram Chukuriya, Visheshana, Shonitapittaroge. Cold exposure to a cold and Madhura Dravya are the major recommended substances in the category of Shonitapitta. Draksha, Ghatak, Shaudrasita, Itena, Vidari, Gandhali, Vipachitena, Kshirecha, Asthapanam, Agri Muktam, Hidam, Bhazam, Japi, Anuvasanatham. A Asthapana and Anuvasana with the Draksha, Ghaza, etc. could be given. Priyangu, Rodra, Anjana, Gairikotpalehi, Swarna, Kaliyaka, Raktachandanehi, Sita, Ashwagandha, Ambuda, Yashtikahva, Yashtikahvaihi, Pradala, Saugandhika, Trilepeshrehi, Nirukshatenam, Vaisa, Samakshikehi, Vritapratei, Shita, Jalavasechidam, Kshirodanam, Bhuktam, Atha Anuvasayeda, Gritena, Yashti, Mutasapitena, Adhoham, Shonitam, Meshanashe, Tatha, Atisaram, Mujrasidustaram, Vireka Yoge to Aditayavashasyate. In case of rectal bleeding, Anuvasana with the drugs like Priyangarodhra, etc. can be given. Niruha Basti with any of these drugs could be given. Something like the Picha Basti, it's something very close to the contents of the Picha Basti. Vamyashcha Rakte Vijitay Balarmitaha. Vamana also could be given in the patients who have a better strength of the body. Evam Vidha Uttarabastescha Mutrashayastre Rudhire Videyaha. If there is a hematuria, then Uttarabasti can be given. Parurta Rakteshu cha Payajeshu Kulya Vidanam Kalu Raktapittam. A rectal bleeding, the same protocol of the Raktapitta has to be followed. Vidisha Asrudgare Pyeshastrinam Karyo Vijanata Shastrakarma Raktam Jayasya Ativa Pravartve. Asrudgara is a pradara in the vaginal bleeding. The same protocol which is mentioned in the Raktapitta could be followed in the pradara and vice versa. And any of those protocols which are mentioned in the context of surgery, that in the context of surgery, the protocols mentioned are Sandhanam, Skandanam, Chiva, Pachanam, Dahanam, Tatha. The Sandhana, Kashaya Rasa Dravyas which are applied over the area, or Skandana, Shita Dravya which is applied, and Pachana, Chara is applied, or Dahana, Agni Karma, Cautery. Any of these protocols could be used as per the context in case of a bleeding patient who has a prolonged bleeding. Trayanam doshanam shonadyapi sarvasha lingani alokya kartavyam chikitsatam anantaram. Once the patient is stabilized, looking at the clinical signs of Vataja Pitta Kapha, you may follow any of the other protocols of the treatment. With this, we will conclude the chapter Sushil Samhita Uttaratantra Tadkate Kachikitsatantre Raktapittapratishedha Nama Saptamodhyaya Adita Panchachatvarimshatodhyaya. If there are any questions, we will try to answer, and if there are no questions, we will wait.